Hello and Assalamu alaikum. Ultrascan Diagnostics said this is the CBCT of the patient that you had requested. The area of interest is the lower right 8 and its evaluation to the inferior alveolar nerve. This is the transaxial view, or basically the proximal view. You can see that distal to the 7, the cyst starts involving the distal part of the lower right 7. You can see the ground portion of the lower right 8. As we move distally, the cyst actually grows from within the crown around the crown of the impacted tooth. So a differential diagnosis is either a dentigerous cyst or a odontogenic keratocyst cyst or a ameloblastoma, which is very unlikely. But because it just is formed around the cemento-enamel junction and around the crown, so are definitely the differential goes towards the dentigerous or an OKC. This is a unilocular radiolucency with well-defined margins. It is superficial to the impacted tooth, involving the body of the ramus and the mandible, angle of the mandible as well. The inferior alveolar nerve is pushed towards the buccal aspect, whereas the impacted tooth is positioned on the lingual aspect. The cystic lesion of the radiolucency goes all the way towards the ramus, and you can see it's just the ends at very close to the lingular region. If you look at it from an axial view or the top to bottom view, here you will be able to appreciate that we have. If looking at it from an axial view, you can see the cystic lesion right here, distal to the 7. This is where the tooth structure or the crown starts and goes all the way. You can see the inferior alveolar nerve marked with orange, and then we move towards the bottom aspect where the nerve gets compressed by the impacted tooth.